Malzberg.
All right, ladies and gentlemen, welcome back. Hour number 3 of the big extravaganza we call the Steve Malzberg Show, Friday edition. For those of you who ventured onto the Drudge Report during the course of the day, the early part of the day, you might have noticed a headline, and if you live in California, you might have fell right off your chair. But it's not the first such headline, and that's what's so disturbing, and it won't be the last, and that's really what's disturbing. Shock, it said, in California, Obamacare to increase individual health insurance premiums by 64 to 146%. To a lot of us, this is no surprise, but joining us now to talk about the disaster that is Obamacare is Sally Pipes, president of the Pacific Research Institute. Hello, Sally. How are you?
I'm well, thank you.
You know, correct me if I'm wrong. Going way back when I was at WOR, you wrote a piece, I think it might have been, I don't remember where it was, about the Canadian system and experiences with it. And I think that's the first time I ever spoke to you was back then. And I do want to get to that. But first, let's talk a little bit about your reaction to this story. And it's based on testimony by the CEO of WellPoint, which is a health insurance company in California.
Right. Well, WellPoint is actually based in Indianapolis. Anthem Blue Cross is their insurer in the state of California. And, we kept hearing from the Obama administration, from Secretary of HHS Kathleen Sebelius, that, with these exchanges, which open for enrollment on October 1st and must be up and running by January 1st, 2014, individuals are going to be able to purchase health insurance. They'll be able to get plans, and they will be a lot cheaper than are available now. Well, of course, Peter Lee, who is the executive director of Covered California, also said that, premiums for people who buy on the Covered California exchange will only see their premiums go down or up by a little bit. Here we are today. The truth is out. Premiums for individuals in California are going to rise from 64 to 146%. And it's shocking to a lot of people, but for people like myself who've been following Obamacare since it was signed into law on March 23rd, 2010, it's not a surprise. I mean, this was inevitable.
Yeah, no, absolutely. And it's not only in California. It may be in California that we see these kinds of hikes, but we've heard predictions recently from various people in position to know that we're talking about, anywhere from 25% to 200%, and doctor shortages thrown in and every other horrible thing that you could imagine. And it's all going to hit at once. And small businesses staying at that 50-employee plateau so as not to have to sign on to Obamacare, or they're laying people off so they won't have to sign on to Obamacare. It's just going to, in every way, just be a burden to this country. But most importantly, really, on how we get our health care. And what these rate increase predictions indicate, Sally, is our ability to pay for it. Who's going to be able to afford that kind of an increase in health care insurance?
Well, I mean, the whole idea of Obamacare, the president had two main thoughts. One was to lower the cost curve, and two, to achieve universal coverage. And we know that already the CBO has said between 2014 and 2023, Obamacare is going to cost about $1.8 trillion, which is double what their number was at $940 billion back in 2010 when the law it was signed when the bill became law. And then second, the Congressional Budget Office has said by 2016 there will still be 30 million Americans uninsured. And, part of this is going to be when you look at the plans in the exchange, particularly in California, there are only 13 companies that are going in the exchange, Anthem Blue Cross, Blue Shield of California being two of them, but Aetna, United, and Cigna have stayed out of the market. They only accounted anyway for 7% of the market. And I believe it's because the regulations for an insurance company in California are so onerous that they weren't even participating in business in California. But the real kicker will be, will young people decide to purchase insurance when the bronze plan in California is going to be for, a young male about $205 a month. And of course that, if they bought a plan today on e-health insurance, it would only be $92 a month. So will young people pay $205 a month? Or are they going to say, I would rather pay that mandate that is $95. It's going to be a whole lot cheaper. And so the people that are in the plans in the exchange, they are going to be putting a lot of pressure on insurance because they're the people that are going to use health care. And so insurers are going to find that their claims are far greater even than they imagined. And what does that mean for premium? And companies aren't going to be able to raise premium by more than 10% under Obamacare. So I see this as a real, as Max Baca said, a real train wreck coming down the road for insurance companies. And, as you mentioned, my Canadian background, ultimately, I think the president wanted a single-payer Medicare for all system. And I think this whole thing is going to crowd private insurers out, and we will be in a Medicare for all system, as the late Senator Ted Kennedy, promoted. And this will be a disaster because, like in Canada, Canadians face long wait lists for care. The average wait today is 17.8 weeks from seeing a primary care doctor to treatment by a specialist. Care is rationed, so if you're a senior and older, you will be less likely to be able to get access to the latest treatments. And the things like MRIs, PET scans, those things are rationed as well. And so this is my long-term fear, unless this legislation is repealed and replaced. But who even knows how many of the exchanges are going to be up and open by October 1st and ready for business on January 1st of 2014.
No, you're right. We're talking to Sally Pipes, president of the Pacific Research Institute. I had a discussion on Memorial Day weekend with a very nice man. He wanted to know, I was at a barbecue, and, talking about the disaster that Obamacare is going to be. He says, yeah, but doesn't it do good things? Being able to keep your kids insured and pre-existing conditions and whatever. I said, okay, so you put that down on one sheet of paper and you pass the 2 or 3 or 4 or 5 or top 10 things that you feel we need to revamp the system. You don't make a 2,000-page bill that we still don't know everything that's in it, something that's going to invade our privacy, drive doctors to go out of business, and just destroy health care and everything we hold dear in it as we know it. It's just not the way to do it.
Well, and then remember, the president gave 58 speeches on health care reform before the law was passed. And early on, he talked about health care reform. But as time went on, by August of 2009, he was talking about health insurance reform. He really, and Nancy Pelosi, they see the health insurers as the villains in our whole health care system. And so things like children being able to stay on their parents' plans to age 26, the end of insurance companies being able to discriminate on pre-existing conditions, the ending of the lifetime caps next year on what insurance companies have to pay out in claims, free preventive care. Even the CBO said all of these things are adding to the cost of health care. They're not reducing the cost of health care. And so, is it any wonder that the cost is going to go up significantly and not down? And so the things that we need to do, we need to empower doctors and patients. We need to change the tax code so that we can build a competitive market in healthcare, reduce all these mandates. I mean, there are about 2,000 mandates on insurance companies across this country. State like Pennsylvania has 65, whether it's in vitro fertilization, hair transplant. All of these things add 20 to 50% to a cost of a premium. How can we keep adding costs to healthcare and expecting insurance companies to stay in business? It's not going to happen. We've already seen Undercovered California. Blue Shield has said that, patients will only have access to 36% of doctors in network. And UCLA has said that if people want to be covered under the UCLA network, they're only going to have access to one plan, Anthem Blue Cross. We are not building consumer choice under Obamacare.
Yeah, no, absolutely not. Sally, thank you for coming on. I'm sure we'll talk many more times in the lead up to this disaster. And thank you for your work, and thank you very much for your time.
Thank you so much.
Bye-bye. Sally.